Greetings on World Heart Day. I am Dr. Bhavesh Vajifdar, cardiologist at Lilavati Hospital since the last 10 years. So today we are going to discuss about the necessity of taking quick action in the first golden hour of a heart attack. We all know that a heart attack can be devastating. It can sometimes be lethal, can take our life, and in most of the cases can make our heart very weak. If the heart is very weak, then our life becomes very slow, because the heart is a muscle, and the muscle which pumps blood to the whole of the body. To pump, the heart needs a good blood circulation. So there are these arteries called coronary arteries which supply blood and nutrients to the heart muscle. During a heart attack, the coronary artery gets completely occluded because a clot formation occurs in an artery which is already having a cholesterol-laden block. When the coronary artery gets blocked due to the clot, the blood circulation to the heart muscle stops and the heart muscle stops functioning. You start getting chest pain and breathlessness, and your heart starts getting damaged. If the artery is opened within a few minutes, then the heart comes back to normal. But as time goes by, the heart muscle damage becomes more and more irreversible. If a few hours are passed, then the heart becomes very weak. So it is necessary that we quickly open the artery as soon as possible, restore the blood flow to the heart muscle so that the damage to the heart is minimal and we can save a life. How can we do this? So about 25 years ago, when I was just into practice, the only way to do this was by giving a clot busting injection. However, in the past 15 to 20 years, now there has been a great progress, and now the preferred mode to open the artery is by doing an angioplasty. So as soon as we suspect that this patient has a heart attack, we do their ECG, do their blood test, confirm that this is a heart attack, and immediately take him to what is known as a cath lab. In the cath lab, first we do a coronary angiography to identify where the artery is blocked, and then once we identify that, then we open it up by using a balloon or a suction device to remove the clot and then put in a stent. This stent keeps the artery open and can save life. So if your near or dear gets a symptom suggestive of a heart attack, you think this is likely to be a heart attack. That means the person gets chest pain or gets breathless, starts profusely sweating or falls unconscious, then quickly take him to a hospital where the doctor can do an ECG, do a blood test called as troponin, and then quickly take him to the cath lab if it is a heart attack and open the artery with a stent. A stent can save life. So do not waste time during this golden hour. Quickly act and take the patient to a hospital where the artery can be opened quickly and the damage to the heart can be minimized as much as possible. Remember, during a heart attack, every minute that the artery remains closed, the heart becomes more and more weak. So we have to open the artery quickly to minimize the damage to the heart. So during the golden hour of a heart attack, do not waste time. Do not waste even a minute or a second. Quickly reach a hospital which is capable of doing this procedure, which is called as a primary angioplasty, to save the patient's life. Thank you.